So last week I talked about what a mast cell disorder is. This week I wanted to talk about getting a mast cell disorder diagnosed. And along with that comes another comparison between Germany and France. So when I first discovered mast cell disorders and went to my doctor about that, I was being seen by a doctor of internal medicine, and he did a blood serum test for tryptase, but mine was normal. The problem I encountered in France was that they weren't really willing to do anything else. So I went from this one doctor to the actual mastocytosis center in France. The first doctor I saw at the mastocytosis center was the one that insulted my French. Yeah, so she checked my skin for cutaneous mastocytosis. Around that time, I ended up setting up a chronic urticaria reaction that was going on for months, and she was telling me that the form of this reaction wasn't consistent with mastocytosis. She did have me do an x-ray, an abdominal sonogram, and a bone density test before referring me to the head of the mastocytosis center. When I saw him, he said that we didn't need to confirm the diagnosis of MCAS because it wasn't going to change the treatment, and I was already receiving the treatment for MCAS, so why bother? Then I realized that I actually do need a confirmed diagnosis, and I was trying to find a mastocytosis specialist in Germany who could give me like a medical certificate saying that I have this. And there happened to be one right there in my city who was technically a dermatologist. After waiting for about a month or so, I got in to see him. He did some blood work, he did like an exam, and my skin was like all cleared up. But then he had me come back to pick up a letter, and he said that he doesn't believe MCAS exists as it's currently defined. I mentioned to him that this French head of the mastocytosis center said that there's no need to confirm the diagnosis, and he laughed about that because apparently they know each other. So, I mean, I guess I'm not surprised they know each other with such a rare disease. He also said that he suspected depression without ever mentioning this to me and talking to me about it, where I could have told him that depression has already been ruled out several times before, but I actually do have an immune disorder. But of course, if he doesn't believe in MCAS, then, what's the point? So then I looked online to see if I could find an MCAS specialist, had to wait another 6 months to see her, and then found out that she actually works with this French head of the mastocytosis center. They share all of their files, but she's actually kind of under him in a way. There's really no way for me to get treatment for this in France while avoiding him, because he is at the very top and everyone else will refer to him. I did get this medication called intercrone, which I believe is the same as gastrocrone. It's a type of chromoglycic acid. I got that from the doctor of internal medicine before I went to the mastocytosis center, but I didn't tolerate it. So I was asking at the mastocytosis center if I could have ketotifen, because I know a lot of patients take that, and we're talking about it and saying that they tolerate that usually a lot better than intercrone or gastrocrone, but nobody would give it to me. It was also generally really difficult in France to get an EpiPen. The only doctor who did eventually give me an EpiPen was the head of the mastocytosis center, and it's not like I'm going into Anna like every day, but still, that's kind of something that you want to have on you, especially in this situation. I also discovered that there's this research group in Germany who is working on MCAS, and started working to get in to see them. The first thing you have to do is get into the Center for Blood Clotting Disorders and Transfusion Medicine. For them, it was a 6-month wait, but I did eventually get in to see them, and they did this thing where if you're like getting an IV or having blood drawn, they put this band around your arm to sort of like cut off your circulation for a few seconds and get your veins to pop out so that they can find the vein and put the needle in. But after they did a normal blood draw, they put the band on again and left it for a full 10 minutes and then took blood again, which is surprisingly painful to have your circulation cut off for 10 minutes. I don't know why I wasn't expecting it to be painful, but basically the summary of their report is that the patient has an elevated risk of bleeding due to heparin release within the framework of a clinically suspected mast cell activation syndrome, or MCAS. The findings increase the probability of the presence of MCAS, but are not proof because of other criteria that need to be fulfilled. Yeah, so basically, just from the blood work alone, that I am at an increased risk for bleeding because of the release of heparin, that I have a bit of a blood clotting disorder, which serves as further proof for MCAS. When I took that report with me back to the Mastocytosis Center in France, okay, they couldn't read it in German, so I was kind of like loosely trying to translate from German into French, but they just completely disregarded it. I figured they can at least recognize some of the medical terminology. They can look at the results from the blood tests themselves and should be able to come to the same conclusions, but they just completely disregarded it and continue to say that there's absolutely no indication that I have MCAS, which is very clearly in contrast to what I've been being told in Germany. Once I got into this blood center and I had the tests run there, I was supposed to go directly into the hospital to have the rest of the tests done. But there was an issue with my insurance, and I ended up having to wait like another 6 months before I could get in. And at one point, I really thought there's no way this is possibly going to work. And I asked them if they could just give me a list of what they test for so that I could have it done in France. So when I saw this MCAS doctor, she said she did want me to see the head of the Mastocytosis Center again, and she contacted him a couple times so that I could get another appointment there as soon as possible. I did eventually get a letter from them saying you have an appointment in like 5 weeks, but it was with a new doctor who was replacing the first doctor that I had initially seen, who was sort of like the second in command. I figured to get the most out of this, I should come in prepared and being a bit more proactive and not sort of waiting for them to do something for me. I got a list of MCAS symptoms and highlighted everything that applied to me and took it into this doctor at the Mastocytosis Center, and he says, well, you know, those symptoms could apply to any disorder. That really doesn't have any significant meaning. And it's like, this is your specialty. And he said that the next thing he'd like to have me do is a bone biopsy aspiration. That would sort of be the next diagnostic step, pretty much the only thing that hasn't been done yet. For some reason that makes me a lot more nervous than anything else. I haven't done it yet. He's looking at the list like, okay, we've basically done all of this stuff before, and the rest of it is just to rule out other disorders. It's not to confirm MCAS. There is no way to possibly confirm MCAS, and they couldn't possibly be doing it differently in Germany because the whole world is held to the standards of the World Health Organization, which means that they're doing the same diagnostic tests in every country. And I'm like, but clearly they're not. So I got back in touch with the hospital and I said, is this just to rule out other illnesses or is this to diagnose MCAS? And they said it's only to diagnose MCAS, it's not to rule out anything else. And once this, once you've completed the hospital stay and the blood analysis and you have all of the results, then you will have a confirmed diagnosis of MCAS, or it'll be ruled out. Every time I asked over the course of the past couple years, no one would give me ketotifen and no one would do a 24-hour urine analysis, which is the next sort of diagnostic step after tryptase. Finally, I was able to get into this hospital in Germany, and I told them that I've already had a lot of these exams done already, you know, maybe it's not necessary to redo everything. And again, in contrast to what they said in France, in Germany, they have the actual results before them, and they're saying, well, we're going to do it again anyways, because, for example, I had a double endoscopy in France, and they didn't take any biopsies. If they had taken biopsies, we could have taken the old biopsies and then had them stained for mast cells, but they didn't take any. So all of that was for nothing. So of course we had to redo the endoscopies in Germany so that they could do the proper biopsies. I'm still waiting on the results for those. The first thing they did in the hospital was an EKG, which was fine. I've had those done in the past and there was never anything abnormal there. The next thing they had me do was start drinking this stuff you have to like clean out your GI tract to prepare for a colonoscopy. Right after the endoscopies, right as I was just like barely starting to wake up, they did an abdominal sonogram, which again I already had done in France. When I did it in France, I forgot that I wasn't supposed to eat first, and in Germany, since I was just coming from a colonoscopy, obviously everything was completely clear and they were able to see clearly, so I guess it's not that bad that they redid it, you know, but still they didn't find anything there. And the final thing I got to do, which is what I've been trying to have done for the longest time, is this urine analysis. And I was surprised, this 24-hour urine analysis. What I had always thought was that you like pee in a cup and you just leave it sitting there for 24 hours. Actually what happens is you have like a pitcher and you pee in the same pitcher for 24 hours and you end up with like a liter of pee, which I was like really surprised that I pee that much in one day. But yeah, considering how much water I drink. I mentioned that to somebody else, like that wasn't what I had envisioned the test being. And their response was, oh yeah, I've had a 24-hour urine test too to test for something else. In my case, for mast cell disorders, you need to test for N-methylhistamine and prostaglandin D2. And I mean, that's something I have asked for countless times in France, and they always refuse to give it to me. And I even tried asking at labs that do urine analysis, and it was like they didn't know what I meant. They had no idea how to do something like that, and I find out that in Germany it's apparently fairly normal thing that people do, like without even having rare disease. The other thing about Germany is at the blood center and the hospital I had the same questionnaire, and they seem to place a lot of weight on this questionnaire. Like they will say, if you have at least 14 points, that means that you likely have MCAS. And I'm like, you know, 20s or 30s or something, like way over. And there are certain criteria that you do have to fulfill diagnostically. And I think in some cases, like where the tryptase is not elevated, you know, it's on the questionnaire and you lose points for that. But if you have a lot of symptoms, then you can make up, make up points in other areas. So I really like the fact that they put more weight on your symptoms instead of just dismissing it and saying, well, we can't prove it clinically, so it must not exist, you know. Obviously, if you're still experiencing symptoms, it seems like at least when it comes to MCAS, that France is really far behind, and I've heard similar stories about Lyme and other types of disorders that are just very poorly understood in France and very hard to diagnose because they just won't do the diagnostic exams and making up excuses like it won't be covered by insurance or we don't do that here or it's not possible to diagnose that or whatever, which is not according to World Health Organization standards, even though they themselves will say that it can't possibly be different anywhere else because of the World Health Organization. So I don't know why things are that way in France, but Between the two, I would definitely recommend Germany as far as getting this diagnosed.